Hello and thank you for joining us on the Thursday edition of Journalists Hangout. I'm Ayodele Ozugbakun. The fight against the deadly coronavirus pandemic is far from over, so let's continue to observe all safety precautions against its spread. Today on the program, governors express concern over increasing COVID-19 cases, say there's need for more measures as federal government consider lockdown review this week. I'll be hanging out with Babajide, Kolade-Otitoju and Asuquo James. So if you're ready, let the hangout start now. Many thanks for joining us again. For the 18th time, Nigerian governors are raising concerns over increasing cases of coronavirus across the country, with 4,971 confirmed cases and more than 190 deaths. State governors want more measures to curb this worrying trend, despite several measures and strategies to prevent the spread of COVID-19. There have been holes in the implementation across board. While citizens continue to violate interstate travel restrictions and curfew, the wearing of face masks and observing social distancing have become nothing but a choice for many. These are genuine grounds for worry about as the federal government considers the review of the lockdown this week. Babajide, Lagos State presently is they have an opinion poll, online that's asking Lagosians, should we go back to locking the state down? Should they continue with their lives the way it is? And the last time I checked that thing, if that is actually from the Lagos State government, because they have the banner and everything on it, the logo and everything. So a lot of people are saying that it's better the state is locked down than what we are having. It is worrisome if by now we have close to 5,000 people carrying. You can imagine if 5,000 contaminated people or people carrying this infection within 20 million people, and that is if that 5,000 is accurate. You can imagine the number of people with coronavirus in Lagos State right now.
Yes, I think that every Nigerian should be worried about the state of things. It is the choice of some people to imagine that this disease does not even exist. But at the end of the day, we just have to take the disease seriously. If you look at the figures, in terms of testing, we have not done well
At all.
Ghana has tested 164,942. The whole of Nigeria, we've not tested 30,000. I think we're on 29 now. 29.
It's 30 now.
We've tested 29,408.
Okay.
29,488. That's where we are. So, and when you look at even the death rate, Ghana has had only 24 deaths. It's the lowest ratio in the world, in Africa, relative to the number of people that they have tested, to the number of people carrying it, the virus. There are more than 5,000 people carrying the virus officially in Ghana, yet only 24 persons have died.
24.
Yes, they are ahead of us in terms of the number of confirmed cases. They have more confirmed cases than us. Yet they are far lower than us in terms of the number of people who have died that we have admitted fell to coronavirus. I have very strong suspicion that some of the people dying in many of the northern states,
Mysteriously.
so there is nothing mysterious. All you need to do is talk to caregivers, medical doctors,
They would have
staff of
manifested
FMCs, Federal Medical Centers, in some of those states. You will know that it's just a game going on. When people tell you it's mysterious, what is mysterious? Apart from coronavirus that we've seen, There's no sickness that can say is mysterious or has never been with us. So what's mysterious about it? They are not dying as a result of disease that we had never encountered. A lot of them are falling to coronavirus. In one of the northeastern states, for example, one big man died. Do you know people refused to attend the funeral because they got information that he fell to coronavirus, and they are aware now that you could be infected if you get too close to the corpse. They are aware now. So the thing is, a lot of governors don't like to see the fact that, oh, there are so many people said to have been infected with the virus in my state. They think this is something that they should hide. But you cannot. The truth, one philosopher said, the truth is like a mole. You cover it on one side, it comes out at the other. You know that insect now. You see it will be going inside the sand. You know, if you like cover it, it will come out at the other end. That's the way the truth is. In the fullness of time, we will know that we have benefited nothing from deceiving ourselves, from not telling ourselves the truth. If we tell ourselves the truth, we can then agree that, look, there are certain steps that we need to take. When we take those steps, things will get better. So, if that opinion poll is something that is credible, I'm just getting to know.
I saw it. I've been seeing it. Asuquo, have you seen
Then
it?
Yes.
it suggests that a lot of people in Lagos know that we are sitting on a keg of gunpowder, and that, look, we need to do something
About it.
You have staff. People come to help you clean your house and all that. You don't know where they go. Yet you can't do it yourself.
You have drivers.
You have drivers. You send the driver to go and buy fuel for you. You don't know whether it's infected. He brings back the car, you sit, and you get infected. It just takes being unlucky.
Can't be too careful.
I look at this figure of the tested in our country, and I'm saying, and I'm agreeing with the governors that we have to ramp up capacity for testing, because it's one of the things that they talked about, and availability of isolation centers, need to buy more PPEs, because a lot of our caregivers are dying. We don't have enough PPEs for people, and we are throwing them to the front line. If South Africa has tested 386,352, it's the highest in Africa.
In Africa.
It's the highest. And it's not as if that. So when you look at even the death rate, South Africa they've lost just 219 persons.
If you compare
We
Nigeria,
compare with our own level of
Yes.
testing and the number of cases.
4,971
4,971.
and our deaths
164.
164.
South Africa, 10,000 confirmed cases, 431. I mean, 550. I mean, that's it's Egypt I'm even looking at. South Africa,
It's
12,074
then
and 209 deaths, 19 deaths. So, my suspicion is that
12,000.
if we ramp up
Can see the
testing,
difference.
if we scale up testing to the level that the Ghanaians have done, we will then see that we have a big problem on our hands.
Now, as well, the compliance level with containment regulations, when you look at it, interstate travel ban, nationwide curfew, pubs, religious gathering, market, etc. From your own assessment, what has been the compliance level?
Well, the compliance level has been very, very poor, you know, especially the interstate travel, which the president even started from first. He said, nobody should travel except you're on essential duty. But we found out that there were so many people who are still flaunting these laws, making sure that they travel from one point to the other, finding illegal routes for them to get to their destination. And even the state governors too, because that is another thing I also noticed. The state governors, even when they said there is no more interstate travel, they didn't also take it upon themselves to go to those terminals that all those buses, take off from, to close those terminals, so that everybody will know that there's no interstate travel. At least that ban should be enforced.
So Jibo now is active.
Jibo is still active.
Jibo, go to
Ikorodu, going to Shagamu, and it's still active.
At least Governor Sanwo-Olu is watching us.
So all those places, all those terminals, yes, you must go there to stop.
People are transferring the coronavirus from Lagos to other states.
They will tell you. They are bringing it.
And they are even bringing it to Lagos too.
So if
they can come in and that is the terminals, they come down there.
Then the next thing, even the Okada that the governor suspended, they are still carrying people.
They are everywhere.
And it's impossible to
don't forget that.
How will we Okada? In fact, it's bumper to bumper.
So even if they want to lock down today, from the poll that, because so many people are saying not every Lagosian is on Twitter and doing that. But majority are saying lockdown. From
those that understand the implication of this,
of course,
we see that we've seen dead bodies in Europe and other countries.
If we want to lock down now, the government should be prepared in terms of making sure that
implementation,
testing immediately. If you close down Lagos, make sure that you force people. If they are going to force people to go to all the 20 local governments to start testing, because we have collection centers, sample collection centers. Let people go there, drop your blood or whatever you want to drop for the testing, so that people will now know, I'm negative or I'm positive. Because
it's not when you begin to show symptoms.
No. Because see, let me tell you, Ayo, the thing is now, like we are discussing it in the office today. It's like the thing is flying. People don't know. Because it can come like malaria and you think it's malaria.
The symptoms are
similar. The symptoms are almost similar.
The bad part of it, some people will tell you that they don't even have the symptoms.
Exactly.
And they tested positive. And you are not manifesting any change.
You don't need to manifest it.
So we need, if we really need to lock down, we must lock down and make sure the testing.
Abakari did not fall sick.
He didn't fall sick. But immediately he knew it was because he went for testing. That was when he now knew that, I'm positive.
Okay. Oftentimes, we blame the breach of COVID-19 containment measures by the people on men and officers of the Nigerian police. The officers enforcing the compliance are accused of taking bribe to allow people contravene various directives. But some policemen are diligent and honest in the discharge of their duties. We have a video where some policemen turned back some travelers for breaching the interstate travel ban and curfew on overnight movements.
What time is it now? What time is it now? What time is it now? What is the time? 3:15 a.m. Yes. 3:50 a.m.
Yes, 3:15 a.m.
3:15 a.m. Yes. Saturday morning. Saturday morning. Kai, Mala, me Sunanka. Adamu, me Sunanka. Amaria, me Sunanka. Eh? 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 So, driver, we are going to turn you back. We don't know where you're coming from. You cannot be moving at this point in time. We would have seized your vehicle, but this is a warning. We don't tolerate this in Anambra State. We'll turn you back because we don't know where people are coming from. Do you understand me? Do you understand me? You don't smuggle people in the name of press. You don't traffic human beings in the name and use a press vehicle. Do you understand me? Do you understand? Do you understand me? You don't traffic people and use a press vehicle. Now turn about. Otherwise, I seize your vehicle. This is Anambra State. Turn about immediately. This is curfew. Turn about immediately. You're smuggling people from other states. Did you understand the exercise here? Did you guys understand the exercise? Yes, sir. You can see that they are smuggling some certain individuals. Yeah. We have to be very alert. Yes, sir. Thank you very much. We have to be very alert here and protect the head bridge.
Still diligent on that duty, you know, and the bastardized the sticker we use press
exactly.
For some of us that were essential workers that we have reasons to move, you know, on that.
They make us come under suspicion. They make everybody come under suspicion.
And imagine
everybody is a pressman, everybody is a journalist. During this period, you see people, even soldiers, turning to kabu drivers just because they want to make money from parking people from one end to another. That's what our friend Atta said now, Ikaro. He said in Abuja, many of the people breaching this thing, carrying people in contravention of the lockdown directives are security people, uniform people. We can't continue to have that. But it is good news that we had people who were there in the night, and they made sure that they stopped those who were trying to come into Anambra State. You saw the bridge, the Niger Bridge. They made sure that they went back. My sister was telling the story that some people took off. When they got to, they passed through, they were stopping, they were on their way. They stopped them. Some policemen, the point I'm trying to make is that there are some states where the police will do the job diligently. You encounter some policemen that you can bribe. Now, they passed through some states, they had bribed their way. The moment they got to, I think, Osun State, they were told to turn back. That's the way it should be. If you like, drive all the way from Yauri or Kauranamoda in Zamfara State. If you get to the boundary between Ogun and Lagos, that's the place where they should turn you back. It will make it extremely painful for you. So our policemen need to be encouraged. Everything is not about money. There are some people who make money during this period, but you will still finish spending it. Your good name is much more important than receiving bribes and all that, and undermining the efforts of the government and the people of Nigeria. We will defeat this pandemic if everyone does what he's supposed to do. If you don't have to leave your house, stay indoors. You don't have to receive too many visitors. These are different times. Not that time when people will come and visit you, play with you. No, the people coming to visit you, you don't know their status. So discourage the idea of people coming to visit you. And you too, you don't have to go visiting people. The times have changed. If you can just stay indoors, stay indoors. But the most important thing, all the protocols that they've set up to improve hygiene, comply with them. You'll be able to protect yourself. Nobody can overprotect himself. You just have to protect yourself.
As well, the states, the Kaduna State, Kano State, how are they doing now?
Well, Kaduna is really doing well, at least, And don't forget the governor also. Another thing we should also look at, from what we just saw now, we saw a government official who decided not to sleep. He went on monitoring. So governors should also find a way, if they are going to send, I keep saying it, commissioners must be involved in this monitoring exercise. We have seen Governor Wike going everywhere, trying to make sure that people respect and obey the directive, the directive, which I think makes a lot of sense, because if we have commissioners right now, most commissioners are not doing they are not doing most of what they are supposed to do in their ministries. They should be able to send them on rotation. Commissioner A, B, C, you are going to monitor this particular point to this particular point today. Tomorrow, another one. You do it rotation, you know, so that everybody, so that this interstate travel ban is taken to the letter. Look at what happened in Anambra. It makes a lot of sense that somebody who is a government official actually went there, at least at that Niger bridge, to turn back people. So no matter where that vehicle was coming from, who that man that claimed, that driver that claimed to be a journalist, no matter where he was coming from, he will now start looking for how he will go back. You know, like we did a report 2 days ago about Lagos. You know, the porous boundaries in Lagos. Ekpe had so many alternative routes that you can use from Ogun State to Lagos. The people are not taking the direct route anymore. They are looking for other routes to enter Lagos. So if the governor can also send out his commissioners, send out his essays, you know, let them go out and monitor all these points, all these entry points. This thing is going to reduce, because what we need everybody to be involved in to curb the spread of coronavirus in all states, because it's not just about pushing money, you know, building isolation centers, but we also have to find a way to contain what we have. If we, for instance, some states that have only 2, look at Anambra now, they have only 2. That vehicle that they turned back, we don't know if
the occupants
they are even affected.
Yes, it was a good decision.
So it was a very, very good decision to say, Mr. Man, drive back. So
what were they looking for?
Yeah, at night, 3 a.m. So all states must, you know, make sure that they try to contain what they have and solve the problem within themselves. Not that they will now wait. Let everybody, all the commissioners, all the SA, let them begin to monitor, go on monitoring exercise at night.
You know, in terms of these isolation centers, because we've seen indication that the way we have it full-blown in Lagos, as in the number of positive people, the number of people carrying this virus, as Lagos prepared ahead of this pandemic, we started with 500 bed space, 500 beds, this thing around the Unicon Stadium, the one they have at IDH, another one at, you know, all over, Bagada, all over.
Yaba.
But the way it is now, these facilities are overburdened already.
Yes.
That's why they try as much as possible to treat people on time and discharge people regularly.
Well,
because when it goes
it's
haywire,
the thing is, I still believe that they're only discharging people when they are convinced that
yes,
those
after,
people
of
are
course, they
well.
must. That's what's
Because if
two
someone
negatives.
spends 2-3 weeks with you and you discharge him too early, you've not really even.
I think they would have carried out the
not done
necessary
well.
tests.
You've not done well for yourself.
Negatives.
So I'm convinced that they are discharging people that are due to be discharged, not just because they are looking for bed space. There is no bed space. The way this thing came, nobody thought that it would hit us in the way it has hit us. So, and our health system was already very weak, both in terms of the availability of health facilities and even enough manpower, quality manpower in the sector. Some of our best have already fled abroad to look for greener pastures. So the one that I'm making is we were not ready for this kind of health emergency. It has come. Now we have to respond appropriately. The more cases you have would require that you improve capacity to take care of them. That is where we have to commend those who are volunteering their buildings to be used as isolation centers.
Organizations,
Government cannot do it alone.
Yes.
It's a good thing that the Catholic Church has done. And across the country, they have enough of those facilities. They will really take away some of the burden on the state. You can imagine Adamawa, they don't have a very big problem of COVID-19, but already the Catholic Church and even one of the bishops donated facility to them. So in Lagos, the people who have considerable means, the rich people, must jump in to assist the government, make available their either hotels or even buildings that they are not using at this time.
Centers.
You know, so that people, after all, you can't even use those hotels now. So why don't you, instead of imagining that, oh, they will soon lift the ban on hotels, why don't you just make the hotel available so that it can be used? The beds will be there. All they need to do is try to reconfigure maybe some rooms, you know, or even if it's a hall that you have, the halls are even better because the way hospital wards are designed, they are designed more or less like halls. You just put beds there and all that. So I think that if those who have event center, those who have halls, they can make them available for government. Let people come out at this time to assist, provide the beds, provide some of the equipment that are needed so that we can have isolation centers. The governors were talking about it that there should be at least 300 per state. I believe that those 300 bed hospitals, I mean isolation centers, can be built by states within some time, but the states still need to be helped by individuals who have the capacity. That way they will be helping the government to solve such a big problem, because we don't know where this will end. Some time ago, the Americans had just 99 cases. I looked at it. Within 2 months, it's now over 100,000. Just within 2 months.
Just COVID-19?
Yes, I'm telling you, people are dead.
Okay, okay.
The number of the dead
Of
in
course,
America.
1.4 million now.
Yeah, within 2 months, 100,000 people are dead. Trump said even Pearl Harbor, the bombing of Pearl Harbor was not this bad. And that was what pushed America to enter the World War. How can you come, our people are enjoying, you just come and drop bomb on their heads where they are enjoying at the beach, you know? But nothing has killed Americans the way this thing has killed them in just 2 months. Even the way it's going, Russia may soon even overtake Spain. So your case may be good today. You don't know when, you don't know how much degeneration will happen, and then you just find that, oh, from a few cases, you are now talking about hundreds. So people need to help the government. I'm happy that the president was full of praise for the Catholic Church, you know, for the assistance that they have offered, and is asking for more. I join the president of our country in asking for more support from the people who have got the means to provide such support.
All right, we'll take this breather. When we come back, we'll discuss more. This is still Journalists Hangout. Stay with us.